Gino. And now back to your hosts, Don Getling and Gino Franti.
Welcome back to the Don and Gino. Actually, Don and Dennis Conference show today. Gino's on vacation, but thank you for joining us on AM 1220 KHTS. And also follow us live on donandgino.com. Click on the YouTube videos. There's literally 200 shows there, over 400 video clips from some of the best professionals you'll ever hear from that'll teach you and guide you to personal and financial wellness. It's a great thing. And today we've gotten great guidance on a hot topic, and soon to continue being hotter and hotter. It's called elder care. And what do we do with our aging population? How do we handle situations with our own parents, our own grandparents? And what are our options? And we have Myles McNamara with Comfort Keepers In-Home Care. That's right. Our local professionals right here in Santa Clarita that are helping us out with this very difficult situation. But the good thing is Myles is very calm, cool, and collected about it because he believes in having a plan, and he can help you with that plan because there's multiple options that you can choose from. The idea is to make sure you find out what your options are so you can make an educated plan for something as important as your parents and your grandparents, heaven forbid.
And yourself.
And yourself. Yeah. Good point. You were bringing that up last segment, is that it's important for you. Otherwise, how do you take care of anyone if you can't take care of yourself? And knowing what your options are can also relieve a lot of pressure and a lot of guilt, I would imagine.
Right.
So what kind of options are we looking at, and how does Comfort Keepers help a lot of us with our with this situation?
Well, one of the biggest options, Don, is that seniors want to stay in their own home. I mean, they've got their memories there. They've been there for 30, 40, 50 years.
Comfortable there.
They don't want to be displaced. They don't want to, sometimes an assisted living facility is a good answer for them, a board and care, what have you. We can talk a little bit more about that. But home care is a relatively new industry. People don't know it exists. They don't know that they can get help as the family caregiver, which is $1 billion industry, by the way, if you put a price tag on the family caregivers out there, because they're non-paid. They're family caregivers, but if you put a wage on it, it's in the billions of dollars. So if you're in that role of a family caregiver, you need a break. You need to take care of yourself. We call that respite care. So maybe you bring home care in for a few hours a day while you go get your hair done or whatever. Or you may, depending on the acuity level of the needs of the seniors, we have clients that we're with 24/7. But home care is non-medical. We can do anything up into where a medical license is required. So, but think about what we do for our kids, or for your parents if you're a family caregiver. We're helping them bathe and shower. We're helping them eat properly. We're giving them their medications when they're supposed to take the medications, which is, by the way, statistically the most frequent reason people go into the hospital is mismanagement of their medications.
I would imagine, because you see it. I mean, it's sometimes multiple bottles of medication.
Absolutely. So we're the non-medical home care, which is the activities of daily living. That's what seniors need a helping hand with. People get that confused with home health. Home health is a prescription needed by the doctor where they will send a nurse into the home, usually right after discharge from a hospital or some kind of a traumatic event, to do medical evaluations, to do the blood pressure, to check their vitals, to maybe put the med tray in order with what meds they're supposed to be taking, maybe make changes in the medication, wound care if that's an issue, if they're addressing wound care. But then they're gone within an hour. So a lot of times seniors are getting home health after they're discharged from the hospital. The nurse comes in and they address the wound, they address the meds, and then they're like, well, I'm hungry, and I got to go. I can't do that for you. That's where a comfort keeper would come in. We'll make sure they feed and eat and stay clean and healthy and what have you. And then you also have hospice, which is end-of-life issues. If someone's come home and they've been diagnosed with 6 months less to live, it's a quality of life thing again. It's keeping the senior comfortable, the pain management
you guys can
level.
help with that as well.
We work in conjunction with those
hospice,
agencies. So that's when people don't understand the options they have for home assistance.
I like that. I didn't know that it's not an either or. It could be an addition to.
In conjunction, that's right.
Right, okay.
So you have home care, you have a comfort keeper there during the day, then the home health will stop in to do their gig for an hour or so, then they leave. If hospice is involved, they come in and they'll make their evaluations and whatever. But so we work seamlessly in conjunction with all these different, a lot of times if a senior's discharged from the hospital, they're getting in-home physical therapy or occupational therapy. All those people can come to the home, and if you can, it's like juggling balls. If you can just work it all together. I mean, I know pretty much all the home health and hospice companies out here and in the San Fernando Valley. We work with them. I've been around for almost 14 years. So we got our golden
So you
Rolodex.
you understand what they're going to do and what their jobs are and how to best work with them because you have experience with them and you have experience with them locally because each one handles it differently, I would imagine.
Well, and that's true. And a lot of times we get calls all the time from the kids who don't know if they need home care yet, but they're just saying help. So we become that trusted advisor, a geriatric care manager, if you will, is letting them know the options out there. Is, again, seniors want to stay in their own home, but that may not be the best option right now. Maybe they need to go into a skilled nursing facility just to get some rehab and work on, in their in-home, physical therapy at the hospital or at the skilled nursing facility. But then they're going to be coming back home when they're stronger and able to survive better in the home. Maybe assisted living is a better option for them, which I basically call a cruise ship on land. I mean, you go to some of these assisted living facilities, and they're great. They have activities, they have the food, they've got getaways and trips and such. So again, depending on what the option is that best suits the need of each individual case, because they differ. And as you mentioned at the break, it could change on a monthly basis, especially with Alzheimer's, as we talked about. What works today with keeping your mom or dad calm and safe and happy may not work next week, because again, it's a progressive, non-curable disease. And
so you might not need that help initially, but as it becomes more progressive, maybe you would.
Right, and we talked about earlier in the show how to start the conversation. We talked about way down the road, planning and ahead, getting that advanced healthcare directive. But now, what happens when you're trying to communicate with that loved one who has dementia or Alzheimer's? There's so many myths out there that you think you're doing the right thing. I'm going to teach you how to do that. If they ask for the salt and they really want the pepper, well, then just give them the pepper. You don't chastise them for calling salt pepper.
Right.
Or and a lot of people,
you're not going to train them.
You're not, and
Right.
and a lot of times hard of hearing. People think, well, I just talk really. No, talk lower. The lower register is what people hear better when they're struggling with the hearing loss.
So you guys can really help a lot with the education process, which I imagine would help in not just caring for them, but help with managing a difficult situation. Nobody wants to deal with this, but sometimes you may be forced into it, or it just happens. It's called life, and our parents are aging. God knows they had to take care of us when we had our issues as kids. And and this will help educate so you can handle it better, because there's got to be a lot of frustration if you're actually fighting an uphill battle.
Well, think about it. You're thrust. What if you didn't know anything about mortgages, Don, and I said, okay, Don, handle this mortgage for me.
Right.
What
do you mean you don't know what an interest rate is? Of course you should know what one is.
So same thing as
Right.
a spouse or someone goes into the hospital. Now they're told by the discharge plan, okay, mom's going home tomorrow, and you're her caregiver.
Well, that brings up a good question, because I'm sitting here listening to you, and I know this is a talk radio show, and I'm fascinated with what
Yeah,
Myles
you should
is
talk.
saying.
I know you are.
I'm like, how do we know who we contact first? Is it as we come out of the hospital or as we come out of that situation? I mean, how do we know we need a comfort keepers versus in-home versus?
Well, actually, that choice is a little easier because you've had a traumatic event and you're coming out of the hospital, and you're probably being told by the discharge planner that you need home care, and if you don't know what home care is, she's going to explain it to you.
Right.
What I try to stress is for people to be proactive, and if the listeners now have an aging parent, don't wait for them to fall and break a hip to get home care.
Right.
Don't wait for them to be hospitalized with a urinary tract infection because they're not drinking enough water. Don't wait for that event. Get home care first to prevent that from happening. Be proactive. So you ask, how do you know if you need it? Well, look into yourself. Are you running around, like I said earlier, taking care of your own kids, and because mom's not eating well, you're going over at 7 at night to make sure she ate, to make sure she took her medications, to make sure she bathed? Who's getting her to her doctor's appointment tomorrow? You're a family caregiver.
Right. Yeah.
So that's the first sign you
Well,
need it.
the other thing, we only got a minute left, but the other thing too, by involving you and comfort keepers involved, is that can also help take away some of the. It gets very personal when it's you trying to take care of them, and where you guys are basically just doing what you know is best for them, and it's not a fight over, trying to tell your parent what to do.
Right. And that's just it. If you get the doctor to tell them,
Mhm.
I mean, as an adult child, again, depending on how you approach it with dignity, kindness, respect, and such, is they would rather hear from someone than their
That's what I'm getting at, exactly. And it's nice to have
get your doctor involved, get your physicians, get your medical professionals involved. If you think mom's getting a little forgetful, go have a full neurological workup done, and let's see if there's a benchmark that we can establish and get a diagnosis so we can start treating it properly.
Right. Well, good information of Myles McNamara with Comfort Keepers in-home care. Again, how can they get a hold of you? Because I know a lot of you really should.
I'm right here on Lyons Avenue, 661-287-4200, or go to seniorcaresantaclarita.com or comfortkeepers.com.
Well, thank you very much, Myles. I love having you on. That's why we have you on a regular basis. I always get educated. I know, Dennis, you had to enjoy it.
I did. I mean, it's something. Like I said, I'm sitting here thinking about my parents, and they're both alive still.
Action,
yeah.
And that's why I try to educate, because we all know someone who has parents.
Yeah.
If we don't have ours with us here still, everybody has parents.
All right,
like you
great.
said, if you don't need me now, you'll probably need me later.
Right.
There you go. Well, you need us because we're coming back in just a little bit. Thanks again, Myles. And we have our real estate hour coming up and more great information that's going to educate you and guide you to personal financial wellness right here on AM 1220.